Hi, welcome back. Dr. Martin Gorman, Encino, California, and we're working our way through integrative dental medicine, the 4 Bs. And today's segment is on breathing. The first thing we're going to talk about is disordered breathing. Now, disordered breathing is anything that affects the way we breathe. Snoring, and something called the upper airway resistance syndrome, and then you have sleep apnea. Snoring obviously is, everyone knows what that is, and everyone thinks it's really more of a social issue, but it's really the first sign that there's something, an airway issue, a blockage somewhere. The upper airway resistance syndrome is called UARS, and it's like restless breathing, and it doesn't really sound like much, but it really disturbs the flow, so you're not getting as much air as you should. And then what we all know about is sleep apnea. And sleep apnea is something that's hugely prevalent in today's society, and the vast majority of people don't even realize they have that issue. So when we think someone has a sleep issue, the first thing we want to do after an examination is recommend a sleep study. And what sleep studies show is that it will differentiate between snoring, upper airway resistance syndrome, and the different forms of sleep apnea. And it will tell us, for example, how long the longest event that you're not breathing for, whether it's a partial blockage or a full blockage. It will tell us your average length of each stoppage of breathing. And it gives us all the data we need to make an informed, accurate decision on how to treat you. So if you do test for sleep apnea, there are multiple forms of sleep apnea. There's mild, moderate, severe is typically how it's graded. And mild and healthy is 0 to 5. Mild is 5 to 15. Moderate is 15 to 30. And severe apnea is anything over 30 events. Also with sleep apnea, we measure the UARS, upper airway resistance syndrome, and it's called this like resisted breathing. And that's a number that's added into the number of blockages you may have, whether they're partial blockages or full blockages, and also the resisted breathing, because we're finding over the last couple of years that a lot of people come in and get tested and they don't have very many apneas, so they're in the normal range, but they have 15 or 20 resisted breathing events every hour, and they still tired during the day, and they still have the different issues that everyone has with sleep apnea has at a lower level. And we're finding that in people of all sizes. Now, if you do find you have sleep apnea, there are typically, the majority of people have what's called obstructive sleep apnea, with this natural blockage. Either your tongue falls back and blocks your airway is just anatomically really small, or your nasal passages are clogged up so you can't breathe, and that's obstructive apnea. And typically it's the tongue falling backwards when you're sleeping that blocks your airway, and when you can't breathe, you wake up gasping for air. That's obstructive. There's also something called central apnea. And central apnea is where there is no effort to breathe, where your brain actually doesn't breathe, doesn't tell you to breathe. And that's more of an issue. And then the third type of apnea is mixed, where it's some centrals and some obstructive. Okay? So that pretty much sums up sleep apnea. Next, we're going to discuss nasal versus mouth breathing. Number one, when you breathe through your nose, the air is filtered, humidified, and temperature controlled, and it goes through your nose, into the sinus, and finally gets to your lungs. And as it swirls through your nose, gets to your air cells here and your sinuses, there's chemistry going on. And the chemistry that's going on is the air in your sinuses is producing a chemical called nitric oxide, N-I-T-R-I-C oxide. And nitric oxide is fabulous for heart health, blood flow, and blood vessel dilation. And blood vessel dilation lowers your blood pressure. So it's a great natural chemical that helps us stay healthy. Normal breathing is nasal breathing. And we've had developed in our society over the last 50 or 60 to 100 years is that most people are becoming mouth breathers. So that means during the day, your lips may be chapped and peeling, the mouth is always dry, you're always drinking water to moisten your mouth. But during the day, most people can get by with their mouth closed, and they do fairly well with nasal breathing. But when you go to sleep at night, everything changes. The vast majority of people become mouth breathers. They wake up in the morning, they're really dry, And the problem with mouth breather, it changes the entire muscular dynamic of the growth and development of your, not only your mouth, but your whole head and face. When you're breathing through your nose, your tongue is up on your palate, and when you swallow, the tongue muscle firmly slams into the palate, allowing for lateral growth, which grows your upper jaw, and at the same time your upper jaw grows, your lower jaw follows suit to match, so your teeth can be set up on top of each other in the correct manner. And another thing that is a little tidbit is that you may know people that get angina where their heart feels tight, and then the heart's just not getting enough blood, and they take a nitroglycerin pill underneath their tongue. What nitroglycerin does, the big fat thing that it does, is it produces nitric oxide for the body in such high volumes that the heart vessels open up immediately and the angina pain goes away because the blood can now flow. So nitric oxide is critical to overall health. Also, in today's environment of COVID-19, there's one study from 10 or 12 years ago that shows that nitrous oxide production prevents viral replication in the lungs. Okay? So it's really good for your heart and preventing virus from coronaviruses from growing and duplicating in your lungs. Now that we've covered breathing, we know that disordered breathing is a problem to our health. We figured out by doing sleep studies, we figure out what kind of apnea you have, and if you're a mouth breather, we have ways to treat and train you to become a nasal breather and cure this problem. Thank you so much for listening. Have a great day.